Alana Kennedy from Little Pine First Nation knows firsthand the toll COVID-19 takes.
My mom did get sick, my dad got sick, I got sick, and my niece.
Some First Nations in Saskatchewan are fighting an uphill battle against COVID-19 with high death rates and case rates twice as high as the rest of the province. Kennedy's mother contracted COVID-19 2 months ago and is still in a Saskatoon hospital.
My mom getting sick really crumbled my world.
Some Indigenous communities have low vaccination rates, including Little Pine First Nation, where 35% of people have received at least one dose. That's well below the provincial rate at 73%. Dr. James McCocus is trying to turn that around. He launched a program called Power of 100. The goal is to increase vaccination rates. Organizers bring music, giveaways, and Indigenous influencers to vaccine clinics. He says vaccine mistrust in Indigenous communities stems from history.
Indigenous peoples who are mistrusting of the health system because of systemic racism, oppression, and genocide are a very different population than those that are protesting outside of hospitals for their perceived infringement on their individual human rights.
In northern Saskatchewan, Leonard Mongrand feared getting the COVID-19 vaccine.
Or I was an anti-vaxxer. I didn't believe in them.
After his friend contracted the virus and ended up in ICU, the Métis leader is now advocating for others to get the shot.
I was talking to him. He seemed okay, normal, everything, and that's how quick the virus can turn on you.
Back in Little Pine First Nation, as Kennedy thinks about her sick mother, she hopes Indigenous people who mistrust vaccines will roll up their sleeves. Omera Isa, CBC News, Regina.